Okay, let's unpack this. Have you ever really thought about how much your body can actually move? Not just, how fast or how strong, but really how far each joint can extend and flex. Today, we're doing a deep dive into something pretty fundamental to how we function physically, but maybe overlook sometimes. Range of motion, or ROM. We're going to pull out the key stuff from our source today. Range of motion, movement and measurement, a comprehensive overview.
Yeah, and what's fascinating here is how this seemingly simple idea, just the extent of movement possible at a joint, well, it turns out it's crucial for basically everything.
Everything, like what?
Well, from preventing those annoying injuries to really optimizing performance. And that's true whether you're, say, a top athlete or you just want to pick something up off the floor without, straining yourself. Understanding ROM is key.
Right. So for this deep dive, our mission really is to give you a quick but thorough understanding what ROM actually is, how it's measured, what things influence it. Some might surprise you why doctors and therapists care so much about it, and most importantly, how you can work to maintain or even improve your own. Think of this as your shortcut to being genuinely well-informed on how your body moves.
And it raises a really interesting question right off the bat, doesn't it?
Yeah.
Why do some people seem so naturally flexible, almost like gymnasts, while others feel stiff just, bending down? What's really going on there? What makes that difference in how our joints move, and what can we learn from that? There's actually a surprising amount of depth here.
Okay, sounds good. Let's dive in then. So the definition first. Our source describes range of motion as basically the complete arc of movement a joint, or maybe a series of joints, can go through. And it's measured in degrees universally, which makes total sense when you picture a joint kind of pivoting, like a hinge on a door.
Exactly. It's the foundation for how we assess physical freedom, really. And to really get how movement is assessed, the source breaks ROM down into 3 types. They're distinct, but definitely connected.
Okay.
First up, there's active range of motion, ROM. This is all about what you can do, moving a joint through its full available range using only your own muscles, no help at all.
Just pure muscle power moving the joint.
Precisely. So it's a direct measure of both your joint's mobility and your muscle's ability to actually create that movement.
Okay, so if I lift my arm straight up overhead, all by myself, that's ROM.
That's it.
But what happens if someone, say, has a shoulder injury? Or maybe just significant weakness? How do clinicians figure out the joint's actual potential then, separate from the muscle strength?
Oh, that's a really critical point. And it brings us to the second type, passive range of motion, or PROM.
PROM.
Yeah. So here, an external force does the moving for you. Maybe it's a therapist's hands, maybe a machine. The key is your muscles are completely relaxed. PROM shows us the joint's structural integrity, the elasticity of the tissues around it, completely independent of whether your muscles are firing.
So it bypasses muscle weakness or even pain sometimes.
Exactly.
Oh, no.
Which is why PROM is often greater than a ROM. It tells you what the joint itself can do, structurally.
Got it. So PROM shows the joint's potential, even if the muscles can't get it there right now. And the third type you mentioned, it sounds like it's somewhere in between. Active assisted range of motion, or ROM.
You nailed it. ROM is precisely that bridge. You start the movement yourself, using your own muscles as much as you can.
Okay.
But then you get some help to finish it, maybe from a therapist, maybe using a strap or even your other hand, just to complete the full range if your own strength isn't quite enough.
So it's like a helping hand.
Right. And it's super important in rehab. It lets you gently push those limits to gradually get back full active control.
Okay, that makes sense. We've got the different sort of flavors of ROM now. Active, passive, active assisted. Let's dig into what actually shapes how much our joints can move. Because, I definitely feel stiffer some days than others. And clearly, some people just seem way more flexible naturally. What are the big factors?
Well, it's really a complex mix, according to the source. Several key things influence it. Age, for one, that's a big one.
Right. We tend to think we just get stiffer as we get older.
We do. And generally, ROM does decrease. But it's not just some vague getting old thing. The source points to specific biochemical changes, like the collagen fibers in our connective tissues. They get more cross-linked, less pliable.
So it's an actual structural change in the tissues, not just wear and tear.
Exactly. Understanding that mechanism really helps reframe how we think about aging joints.
That is helpful. What else?
Gender also seems to play a role. Generally speaking, women tend to show greater flexibility than men across most joints. And then, beyond those sort of inherent biological things, your physical activity level is huge. Absolutely paramount.
Okay.
Regular exercise, consistent stretching, these are incredibly important for both maintaining the ROM you have and even improving it. It's like constantly signaling to your body, hey, I need this movement range, keep it available.
So that old saying, use it or lose it, definitely applies here.
It really, really does for joint mobility.
What about those times when movement feels suddenly restricted?
Yeah.
Like after an injury?
Oh, absolutely. Injury or disease can drastically limit movement. Things like, well, arthritis in its various forms, or an acute muscle strain, a fracture, those are obvious culprits.
Sure.
But another factor, maybe less obvious, is muscle temperature. Warm muscles allow for significantly greater ROM than cold ones.
Ah, the warm-up.
Precisely why warming up before you do anything physical is so crucial. Even the time of day can matter. ROM tends to be a bit greater later in the day, likely because our core body temperature is naturally a bit higher then.
Wow, okay. So age, gender, activity, injury, temperature, even time of day, a lot going on. Now, this is where it gets really practical for anyone interested in their health. Why do healthcare pros like physios or doctors actually measure ROM? What's the point of getting out that tool, the goniometer?
Right, the goniometer. Well, connecting this to the bigger picture, ROM assessment is really a cornerstone of physical exams in rehab. Professionals use these precise measurements for a few critical reasons. One, to get a baseline. Where are you starting from before any treatment?
Okay, a starting point.
Exactly. Two, to objectively track progress. Are you getting better during recovery from an injury or surgery? The numbers tell the story. And three, crucially, to spot problems. Maybe subtle movement limitations you wouldn't otherwise notice, or even those compensatory patterns.
Compensatory patterns, like moving weirdly to avoid pain.
Yes, exactly. Where your body is unconsciously finding inefficient ways to move around an issue, which can cause other problems down the line. Measuring ROM helps uncover that.
And I guess they also use it to design the right exercises for you, right? Making sure the rehab plan actually fits what your body needs at that moment.
Perfectly put. It's vital for tailoring exercise prescriptions and also for figuring out your functional capacity. What can you actually do in daily life? Knowing the normal ROM values is key here. For instance, the shoulder joint has this huge range, right? About 180 degrees of flexion, letting us reach overhead.
Yeah.
A joint like the knee, more limited, but functionally it needs about 135 degrees of flexion. If your knee can only bend to, say, 90 degrees. Well, simple things like tying your shoes, getting in a car, they become really difficult.
Ah, I see.
So measuring ROM lets professionals immediately pinpoint those specific functional limits and target the treatment effectively.
Suddenly that goniometer, that sort of protractor-looking thing, sounds incredibly important. It's not just some simple little tool.
Not at all simple in its impact, no. Its precision lets us pick up on really subtle changes that might, predict a future injury risk or show that specific, often overlooked compensation pattern your body's adopted.
All right.
And the source really emphasizes doing it correctly. Proper patient positioning, aligning the goniometer just right with the joint's axis, using consistent methods every time, and always noting any pain or stiffness the person feels during the measurement. It's quite a rigorous process when done right.
Okay, so we've got a much deeper understanding now. What does all this mean for you listening right now? When it comes to looking after the range of motion in your own body, what are the practical steps?
Well, the source is pretty clear on this. Regular, consistent stretching exercises are, by far, the most effective way to maintain and improve your ROM.
Stretching. Okay, but
some key principles come up. Daily practice is one. This isn't really a once-a-week thing if you want to see real results. Consistency is vital, daily. Also, gradual progression. You never force a movement into pain. That's crucial.
No pain, more game.
Sort of. It's about gentle progression. Holding static stretches for about 15 to 30 seconds seems to be the sweet spot. And maybe most importantly, always perform movements through pain-free ranges. Pushing into pain, that's usually counterproductive, potentially even risky.
So gentle, consistent, patient. Sounds like the mantra.
That sums it up pretty well. And often, incorporating a mix of different types of stretching, like static holds and maybe some gentle dynamic movements, can be really beneficial. Plus, don't forget strength training. Strong muscles help support the joints as they move through their available range, including any new range you gain.
Right, it all works together.
It does. Understanding these basic ROM principles really empowers individuals to take care of their joint health long-term, prevent injuries, and just optimize how they move and perform throughout life.
Yeah.
And like we said, it's not just for athletes or people in rehab. It's about your everyday ability to function, to live your life freely.
So wrapping this up then, What does this all mean for you now that you've got this deeper understanding of range of motion?
Well, if we pull it all together, connecting it to that bigger picture, it really becomes clear that understanding ROM is about proactive self-care, isn't it?
Yeah.
We've looked at how it's measured precisely in degrees, the key differences between active, passive, and that active-assisted ROM, and how all those factors, age, gender, activity, even the time of day, can influence how your body moves.
Yeah, we really highlighted the practical side, didn't we? Like the huge role of that consistent daily stretching. Holding for 15, 30 seconds, progressing gradually, always staying pain-free.
Yeah.
That's key for maintaining optimal ROM.
Sure.
It's not just about, peak performance in sports.
Yeah.
It's fundamentally about your ability to interact with the world around you without restriction, day in, day out.
Which brings us to a final thought, maybe something to ponder. Knowing that ROM does tend to naturally decrease as we age, unfortunately, but also knowing that consistency in daily practice is so important. Well, it raises an important question, doesn't it? How can integrating even really simple, pain-free movements and stretches into your daily routine, maybe just a few minutes, how can that become a proactive, really powerful investment in your long-term physical independence and your overall well-being?
It's definitely something to think about as you go about your day. We really hope this deep dive into range of motion has given you a fresh perspective on how your amazing body works.